Hi there, welcome back to the Social Television Network. I'm Chris Coraggio, joined today by Dr. Sachin Mehta. He is a vitreoretinal surgeon with the Retinal Consultants of Arizona. Doctor, thanks so much for being here. We appreciate it.
Well, thanks so much for having me. It's really a pleasure to be here.
You got it. The topic today is diabetic eye disease. First, let everyone know what exactly that is.
Yeah, so diabetic eye disease is something that's a major health concern. It's a major cause of vision loss in people with type 1 and type 2 diabetes. And it specifically affects the back of the eye, a tissue called the retina, which is a light-sensitive tissue that's responsible for our sight. It's like the film of the camera. It captures the image and sends it back to the brain so we can see. So in diabetic retinopathy, the retina gets damaged and it causes vision loss.
And what are the symptoms? What do people experience?
Yeah, so a lot of people experience either central blurring to their vision, or they can even get floaters, loss of vision, blockage of vision. There's a big variety of symptoms that patients can experience, but the bottom line is once it starts affecting the vision, it's important that we get treatment on board right away.
Sure. Okay, before the treatment though, so folks might be having these symptoms, right? They come to see you. Correct. How do you diagnose it?
So we diagnose it with a dilated fundoscopic examination. So we dilate the pupil, and that gives us access so we can view the retina. And we're specifically looking for leakage and bleeding from the small vessels that feed the retina in the back of the eye. And if we see that, we want to make sure that we treat it right away. The diagnostic modalities that we use include OCT scanning, which is just cross-sectional images of the retina. It'll give us an idea of whether or not there's any fluid building up in the back of the eye. And also fluorescein angiography, which is a dye test, and it helps us determine how good the circulation is in the back of the eye.
Okay. And then treatment. So you diagnose it, and you said you want to treat it right away.
Yeah, it's really important. The sooner that you can diagnose and treat diabetic retinopathy, that usually leads to better visual outcomes. And so we bring the patient in, we do the fundoscopic exam, and then if we determine that they have macular edema or something called neovascularization, which is abnormal blood vessel development.
And that falls under diabetic eye disease?
It all falls under diabetic retinopathy, that's correct.
Okay.
If we determine that they have those things, then we can treat them either with laser treatments in the office, intraocular injections, which we can perform in the office, and that sounds awful, I know, to get a shot in your eye, but we can keep it very painless with our anesthetic techniques.
Okay.
And if it's very serious where they have bleeding in the back of the eye or retinal detachments from the diabetes, we can take them into surgery and do a procedure called a vitrectomy. And that's when we go in there under local anesthesia and we make small incisions into the white part of the eye. That gives us access to the back where we can clean out the blood and fix the retinal detachment.
And outcomes are usually very good?
Outcomes are usually good as long as we're able to get to it early enough.
Got it.
In advanced stages of diabetic retinopathy, no matter what we do, often we can't improve the vision.
Well, that leads me to my final question, is getting to it early. And
Correct.
What's the best way to do that? Get out ahead of this,
Yes,
right?
exactly.
How
So
do you do that?
the best thing that you can do
For diabetics.
is, control your blood sugar. So blood sugar, blood pressure, and cholesterol control. And so how you do that? Well, the best way is with diet. You know, you want to make sure you reduce your sugar intake, your fatty food intake. You know, those things that cause other problems in the body can cause problems in the eyes and diabetes. So you got to make sure you control the blood sugars, the blood pressure, and the cholesterol. Those are the key things.
Folks, if you would like more information, you can go to the website. It's retinalconsultantsaz.com. Dr. Mehta, great information. We really appreciate it.
Thank you so much. Really a pleasure being here.
You got it. Folks, we'll see you next time here on the Social Television Network.